Congratulations on closing the deal almost a year to the day.
Almost.
Since you announced it. So you talked about creating what is essentially a new kind of health system as your sort of front door to healthcare in your neighborhood. As we are on day one, talk a little bit more about how you see that vision evolving.
Well, Bertha, we all see the challenges that our healthcare system faces today. It's confusing. It's difficult to navigate. There's a growing cost burden that's being placed on consumers, and as a result, oftentimes, care is fragmented, and as I mentioned, it's too expensive. So we see an opportunity to create a new healthcare platform, one that's simpler, easier to use, and puts consumers at the center of their care. So we're very excited to get going. It is a special day, and it's been a lot of hard work by our respective teams, but we're ready to get going.
You have been working together over the last few months as you've been preparing for this. Talk about what you do first. What can we expect first? How easy is it going to be to integrate Aetna's systems with CVS's systems to bring about some of the things you're talking about in terms of making it easier through technology, through AI, artificial intelligence, to figure out what's going on with people's health care?
Well, Bertha, we see three imperatives to bring this vision to life. One is the opportunity to be local and to be able to provide access for consumers in terms of where, when, and how they want to be able to access care, whether it's in the community, in their home, or in the palm of their hand with a digital device. As we were talking, the opportunity to make it simple, and we see opportunities to create a more connected experience where consumers can more readily access resources, information, the services that they need. And the third imperative is to help people achieve their best health at a lower cost. And you look at what is resident within the Aetna business today. They have a tremendous amount of information that they can identify what is the next best action for the members that they serve to help them on their path to better health. Where the system breaks down is how do they activate that? How do they engage with those healthcare consumers? And
so now the CVS store and Minute Clinics are going to be the place where that happens?
Exactly. We have many community assets. We're in 10,000 communities all across the country. This combined entity will have more than 45,000 healthcare practitioners. So it's that connectivity that can make a meaningful difference in how care is provided across the country.
David, I believe, has a question for you. David?
Thanks, Bertha. Yeah, Larry, it's David Faber. Looking at the stock and speaking to some of your investors and or those who might become investors, there seems to be a bit of a wait and see in terms of delivering on what are enormous cost synergies that you've outlined here. What can you tell those investors in terms of your expectations or what they should be focused on and how you're executing on gaining those synergies that you laid out some time back?
Yeah, David, it's a great question, and we've talked about synergies of more than $750 million, in the second full year of operation. And over the last several months, integration team with members from both companies have done a tremendous amount of work, and we're very confident in the pathway to achieve those synergies. Part two of that discussion is what we were just talking about with Bertha in terms of the opportunity to bring meaningful change, to healthcare and, to be able to actually reduce medical costs. When you look at, the avoidable and wasteful spending that, if we just use the management of chronic disease today, we have about 60% of Americans that, have one or more chronic diseases. It's accounting for 80% of healthcare costs, and we know and we can do better. I think one of the things that investors are missing is the fact that the healthcare industry can and must be transformed from within. And this combination of CVS and Aetna, brings together the assets, to in fact be able to do that.
Yeah, Larry, do you think investors are having trouble sort of understanding what your peer group might be and therefore how your stock should be valued in terms of a multiple? Are you a retailer, HMO, with all three of these important companies put together, do you even have a peer that you could say this is kind of what we expect or who we compete against?
Well, David, it's an interesting question. And, over the last several years as, CVS and Caremark came together back in 2007, we began to talk to the investor community about, we manage the company at an enterprise level. And I think that's enabled us to bring products and innovation into the marketplace that, have improved access at that time to, pharmacy care, and at the same time to be able to drive down the cost of care. So the addition of Aetna to the CVS Health family, gives us another arm of capability and, the opportunity to bring new products and services, into the marketplace that can achieve the goals that we just talked about.
A lot of the narrative, it's Sarah Eisen, Larry, good to have you. A lot of the narrative around this deal had to do with the fact that everybody, including you, were bracing for Amazon to enter the sector. And then we saw Amazon buy PillPack, and I know you've got a competing Prime sort of offering. Can you just talk about whether you think that story is overplayed or whether you expect Amazon to really enter your space and be a top competitor?
Well, there's no question that, Amazon has been a formidable competitor across the marketplace. We have tremendous respect for our competitors. And I think what is interesting around, our particular thought process is that, we're laser focused on, how do we satisfy the needs of the clients and the consumers, the members that we serve. And that's what, we get up every morning and, charge ourselves and, our thousands of colleagues across the country to do that very thing. And, our belief being that if we're taking care of the needs of our customers, then, we'll be able to hold our own in terms of, competing against existing competition or perhaps new competition that may enter the marketplace.
You're going to be launching some concept stores to work this through over the next couple of months. How will you look at whether those are a success? I think that's one of the things that investors want to know. How will we know if it's a success integrating all of these pieces?
Yeah, Bertha, great question. And as you look at the role of CVS Pharmacy today, people think of drugstores on corners all across the country. We see an opportunity that we can become more than a drugstore. We can become more of a healthcare destination. When you think about the role of the pharmacy, the role of a MinuteClinic.
So explain to me what this concept store would look like.
Yeah,
less products in the front of the store, more services in the front of the store?
Yeah, the front store will evolve into a combination of products and services, and we'll continue to have a focus on health, beauty, personal care, elements of convenience, but you'll see services, an expanded MinuteClinic where we'll be able to do phlebotomy, or services that will help patients understand how to best use their benefit. Or one of the opportunities that we see, think about a patient who was recently discharged from the hospital, well enough to leave the hospital, but still needs some convalescence in the home, and maybe they're not as mobile. And how do we work in the community to create partnerships so that if they can't drive a car, we can make transportation available? Or if they're just not well enough to cook their own meals, how do we make food readily available for them? So we're excited about creating those opportunities as being an integrator of services that patients, consumers of healthcare need at any different point in time.